Hey everyone, and welcome to Farmer Mind. Ever wondered what really happens in the body leading up to a type 2 diabetes diagnosis? It's not a switch that suddenly flips. It's a story, a cascade of events that unfolds over years, sometimes even decades. Today, we're going to visualize that story. We're going to animate the step-by-step journey from a perfectly healthy body to one grappling with type 2 diabetes. Let's get into it. First, let's look at a healthy body. Picture this. You just enjoyed a meal. The carbs you ate cause your blood sugar to rise, which is totally normal. This rise is like a signal. Your pancreas gets the message and sends out the hero of our story, insulin. Now, think of insulin as a key. It travels to your muscle and fat cells and fits perfectly into a special lock, the insulin receptor. This turns the key, which sends a signal to open up thousands of tiny gateways called GLUT4 transporters. Glucose floods out of your blood and into the cells where it's used for energy. And just like that, your blood sugar levels go back to normal. Perfect harmony. But what happens when those locks start to get rusty? This is insulin resistance, the very first domino to fall. Things like genetics, excess body fat, and chronic inflammation can cause the cell's locks to change. Now, when insulin shows up, the key still fits, but it's much harder to turn. The signal is weak. Fewer gateways open up. The result? Glucose gets stuck in the bloodstream. Sugar levels stay higher for longer. Now, the pancreas, sensing this problem, does the only thing it can. It fights back. It starts pumping out way more insulin to try and force those rusty locks open. Think of it like a factory running on overtime, 24/7, trying to meet an impossible demand. And for a while, this actually works. This state is called compensatory hyperinsulinemia. The massive flood of insulin keeps blood sugar mostly in check, maybe in the pre-diabetic range. The system is under incredible stress, but it's holding the line. But here's the tragic twist. That factory can't run on overtime forever. That constant flood of high sugar and fats in the blood is actually toxic. It starts to poison the very beta cells in the pancreas that are working so hard. This is called glucotoxicity and lipotoxicity. They get exhausted, they start to malfunction, and eventually they begin to die off. The pancreas can no longer keep up. It goes from producing too much insulin to not producing enough. And now, the full picture of type 2 diabetes snaps into focus. You have a dual problem, those rusty, resistant locks on your cells and a failing insulin factory in your pancreas. But wait, there's a third troublemaker, the liver. Normally, insulin tells the liver, hey, we've got enough sugar, stop making more. But with insulin resistance, the liver can't hear that signal anymore. So it starts dumping even more sugar into your blood, especially overnight. This is why high fasting glucose is a classic sign. This perfect storm, resistance, a failing pancreas, and a rogue liver is what creates the chronic high blood sugar of type 2 diabetes. So let's trace that path one last time. It starts with resistance, the pancreas overcompensates, then the pancreas begins to fail, culminating in overt diabetes. It's why we use drugs like metformin to make the locks less rusty, why other therapies work by supporting the pancreas, and why, down the line, many people need to take insulin themselves. It's not just a diagnosis, it's a journey. And understanding that journey is the first step to managing it. Hope you found this helpful. Don't forget to subscribe for more learning videos.